So B12, there's always this question, and I get three different answers on it. But with regard to methyl cobalamin and cyanocobalamin, or it doesn't matter. Where do you come down on that question?
Well, it's an interesting question too. And at first, looking at the two, methylcobalamin and cyanocobalamin are both forms of vitamin B12, which is cobalamin. And when you eat them, they're broken apart and you absorb the cobalamin, which is very difficult. It's a long story. But one reason that I like methylcobalamin is that if there's cyanide in your system, it will help to flush it, whereas a cyanocobalamin does not. And so I prefer it that way. The cyanocobalamin is more stable in formulas. So manufacturers who are manufacturing only for profit will use the more stable form and use less of it. It's cheaper. They make more profit. So I do use the methylcobalamin form in my brain and body food. I put in 200 micrograms per day, and that is my only source of vitamin B12. I mean, I eat absolutely zero animal foods. I've been plant-based for 55 years. And so when my blood tests come back with lots of vitamin B12, I know the methylcobalamin is working. However, I read studies where they use cyanocobalamin, which is typical for studies, and they still raise the B12 in blood. So that can work too. So both are possible. My preferred form, if you're a smoker, I would say definitely methylcobalamin because the cyanide in cigarette smoke is a problem, and this can help to relieve that problem. There are other sources of cyanide too, and why not eat the best source? That's how I feel about it.
I said if you, I have a feeling that if you're a smoker, you're not too concerned about your B12. But I was just, I was just making a light joke.
Possibly there could be other bad health habits go
Yes.
along with smoking. Yeah.
Yes. So, what is the relationship between diabetes and dementia? Does diabetes happen first, and then you get dementia kind of from a diabetic body, or do they happen simultaneously and they're both manifestations of the same pathology? Can you talk a little bit about that?
It's not the same pathology at all. They're not the same. The actually, I've studied how insulin works in the brain, and it works completely different than it works outside of the brain. It's really completely different. The idea of type 3 diabetes doesn't work at all if you study how insulin works in the brain. That's not the problem with dementia. Dementia, the problem is that people are losing brain cells. Okay. They're losing brain cells because of environmental toxicants that are damaging the brain cells. For instance, in Parkinson's disease, there are specific environmental toxicants that are killing off dopamine producing cells. And then in Alzheimer's disease, basically you're getting too many industrial pollutants and too few antioxidants and anti-inflammatories. This is where the whole food plant diet really comes in, loaded with antioxidants, loaded with anti-inflammatories. The end result of how brain cells die in an advanced Alzheimer's disease, you're looking at half of the brain cells dead. So when someone says they're going to restore someone from advanced Alzheimer's disease, this is just not possible. Half of the brain cells are dead. How did they die? Oxidation. They were killed off by having too few antioxidants and too much inflammation to increases. So several of my recent papers have been on neuroinflammation, brain inflammation, and how to stop that with food. And it's pretty simple. It's a whole plant diet and stay away from the animal-derived foods. Diabetes is completely different. That's about eating too much sugar and not being able to get the sugar out of the bloodstream because of saturated fats. Saturated fats also are a risk factor, of course, for dementia. Vascular dementia is almost always coexistent with any other form of dementia, like Alzheimer's disease. Vascular dementia induced by saturated fats, clogged arteries, tiny strokes in the brain. This is vascular dementia. Strokes also related to saturated fats and dementia, and again, plaque breaking away and creating strokes. So it is the foods that are damaging us in different ways. The same food in this case, maybe saturated fats, excess, are giving us diabetes and dementia.
So with regards to what you said about Alzheimer's, where like, by the time you have advanced Alzheimer's, half the brain cells are gone. We've had people say that the symptoms were able to be somewhat mitigated. Is that possible? Without maybe restoring, half the brain back, you can mitigate the symptoms?
Well, I think that if we're talking about, okay, let's start normal brain of aging, a little forgetful. Where are my keys? Make a list to go to the store. Okay, that's one thing. Then mild cognitive impairment, the precursor to dementia, where people progress from mild cognitive impairment into dementia, perhaps 15% of them per year will graduate to dementia. Then we're talking early Alzheimer's disease, during which there is definitely a chance to help both with symptoms and with memory. And in my study, which is the very beginning of that, the Hawaii Dementia Prevention Trial, they were at 19 out of 30 on the mini mental status exam. And at the end of 9 months, they were at 29 out of 30, so high normal. So in very early Alzheimer's disease, reversal of symptoms and of health is very possible. But as you progress to moderate Alzheimer's disease, it becomes very, very difficult. Just like with after one or two strokes, it's very difficult, or after one or two heart attacks, it's difficult. We want to get people before this happens. I really want to encourage people to stay healthy and avoid dementia, avoid diabetes, and all of the other chronic diseases, as many of your speakers have put it very eloquently.
So if we are eating a whole food plant-based diet, an appropriate one, and we are, we're exercising, we're getting good sleep, we are mitigating our stress, do we need to fear getting diabetes? Is there other factors where and I'm supplementing with B12 appropriately. Is there other things that can just all of a sudden we still get dementia despite doing everything right?
If you add keeping saturated fats below 12 grams to everything you just said, then I'll say, no, I'm not worried about it. And there are whole populations who don't get diabetes, who are very susceptible to it. For instance, in Hawaii, there didn't used to be any diabetes. Now it's rampant. And what changed? It's not the genes of the people, it's the food they eat.
And how much I didn't see on your slide, how much is there saturated fat in avocados?
There's a little saturated fat in avocados, but here's the thing. You get 12 grams for free every day, so don't worry about it. If you're getting maybe 2 grams of saturated fat eating a nice juicy avocado, okay, you've eaten 2 of your 12 for the day, no problem. And then if you eat some chocolate and you eat another 3 or 4, wait a minute, you're still only up to 5 or 6, so you're okay for the day. And then later in the day, you eat some nuts and seeds or some peanut butter or something, and you wind up getting up to 11 or 12, no problem. But if you go over that, then you want to look at how you can just slim it back down. Of course, when normal Americans on a normal American diet look at it, they're eating 12 grams several times each meal. So it's going to be harder for them to slim down their saturated fats. But there are substitutes. My wife's cooking books really help with that too.
So you talked about fiber, and on the slide, it said between 30 and 50 milligrams of
No,
fiber.
30, 50 grams.
I'm sorry, I'm sorry, yes, grams. And you said then you recommended 40 would be ideal or above 40. So our last speaker, Milton Mills, played a video from Michael Greger, where he went into like the history of finding fossilized, I forget what the name of what it's called, but fossilized stool,
Yeah.
right?
Fossilized poop. Yes, I saw that.
Yes. I wish I had the fancy name for it, but and they said that the specimen, if you will, showed that these people were eating somewhere over 100 grams of fiber a day. Also, there are populations in Africa that are eating over 100 grams a day. Is that where we should actually be, whether or not we can get there? And would that
I
convert?
don't think so, Michael. I don't think that that's reasonable. For example, when you look at children, they can't get enough calories and protein and other nutrients they need if they have too high a fiber diet. So some of their foods need to be a little lower in fiber. And that may be true for older folks too, whose digestion isn't so strong that they can actually digest a huge amount of fiber. And we're talking about fiber from whole plant foods now, not added fiber.
Mm.
So it really is, I have pegged 40 grams per day as optimal. 20 grams per day is the RDA for fiber. I analyzed the carnivore diet. Can you guess how much fiber was in that one?
I'm gonna say not very much, maybe 10 grams.
Zero. I have never seen that
Oh,
before.
the carnivore diner. Okay, that's
Carnivore diet.
all meat, just like all
Yeah,
meat.
all meat. The Atkins diet blew me away when I saw it was only 3 grams of fiber. They're probably going to the bathroom at least once a week on that. But it's not enough. And a lot of the diets that I see out there, I analyze all of them, and a lot of times the fiber is very low. So no, 100 grams would be too much for most modern digestions. Perhaps a super fit person could do it, but you couldn't be too fit because you're going to need more calories and more food to get in there. And remember, fiber does not have food value. Its value is to go into the intestines. And so you don't get carbohydrates or protein from fiber. You don't
Okay.
get fats from fiber. So there's nothing to make energy from fiber. So you also need those other foods. So I would still stick with my 40 would be healthiest, 20 is the minimum. But going over 60, I think is I've seen it, and especially in some raw food vegan diets that I've analyzed, they've gone over 60 and they're okay with that because it's mostly fruit and vegetables and they seem to do well, but they're usually younger and stronger and can take it. So I think over 100 would just be too much for our digestions to handle. Plus, you'd need a porta potty.
Is it possible that the reason that they had 100 grams, or I think it was like even more like 120 grams, is because their food is, these plants that they were eating weren't so dense in those other nutrients, so they needed to consume so much food, and in so doing, consume so much fiber, and they
Yeah,
basically were
sure.
eating all day? Okay.
Sure, of course. Yeah,
Uh,
they're eating fibrous plant foods, and they do have to eat a lot to get calories because after all, fiber doesn't have any calories.
okay. So so dates. I don't know if I saw that on your slide. How are dates with regard to sugar, and how are dates with regard to fiber?
They have some fiber, they have some sugar. The sugar's fairly slow releasing. I've seen a lot of studies on dates for diabetics, and it's what diabetics do is they test their blood sugar.